Use a pencil to mark the margins all the way around the tooth so that they can be clearly identified. Begin by sealing the margins with a coat of wax surrounding the tooth. For demonstration purposes, blue wax is used in order to differentiate between different stages of the wax-up procedure. After sealing, use the Carver or number 4 instrument to remove the excess wax from the margin. Use the root form of the tooth to help clean the tooth by placing the instrument against the root and carefully scraping the root and any excess wax with it. Once the margins are sealed all around, cover the entire tooth with an even coat of wax. Concentrate on restoring the facial aspect of the cuspid. Remember that the distal marginal ridge of number 10 and the mesial marginal edge of number 11 must be parallel to each other. Likewise, the mesial marginal ridge of number 12 and the distal marginal edge of number 11 must also be parallel and close to each other. This way, the teeth will not only have a uniform look, but the spaces between the teeth will also be sealed. Anterior teeth are waxed first for aesthetic appearance of the restoration and secondly for functional considerations. Here we apply tooth-colored wax to seal the tooth. Keep in mind that the mesial incisal marginal ridge is shorter than the distal incisal marginal ridge. At this point, excess wax is not a problem as it can be removed later. Once the general shape and form of the tooth's facial aspect has been restored, use a carver to carve away excess wax and to achieve the final shape. Use a toothbrush to clean the wax carvings off the tooth if necessary. Note that the distal facial aspect of the cuspid is wider than the mesial. Labiolingually, the mesial aspect is thicker. Carve the distal marginal ridge and the mesial marginal ridge until smooth. Next, concentrate on functional considerations in restoring the lingual aspect. Again, start with the distal and mesial marginal ridges, aligning them with the marginal ridges of the adjacent teeth so that there is uniformity and continuity. Check periodically with the opposing model to gauge how much room is available. After opening and closing the model, there should be an indent in the wax that was just placed. If there is no indent, then the wax was not placed high enough. It is important to remember that the lingual mesial half of the maxillary cuspid is the functional area of the tooth, or where the opposing cuspid is gliding along for lateral disclusion. Apply enough wax so that this part of the tooth is bulky, as it has to support the forces applied to it by the musculature. At this point, occlusal contact should be established on the cuspid. Cuspal acentric movement involves riding on the cuspid while at the same time discluding all of the posterior teeth, so that they are not in contact with each other. Also note that the mesiofacial marginal ridge or line angle of tooth number 11 is parallel to the mesiofacial marginal ridge or line angle of tooth number 10. The distofacial marginal ridge is in line with and parallel to the mesiofacial marginal ridge of tooth number 12, and the incisal cuspid is tilted mesially, and the incisal mesial marginal ridge is shorter than the incisal distal marginal ridge. On the lingual aspect, there should be a strong cingulum with the lingual mesial marginal ridge in line with the distal marginal ridge of tooth number 10, and the distal marginal ridge in line with the mesial marginal ridge of tooth number 12. Confirm that there is good vertical contact. The lower tooth number 22 should occlude into the mesial lingual half or incisal third of tooth number 11 as shown. In addition, all posterior teeth should be occluding at the same time. When we use the cuspal guided movement to the left of the working movement, the only contact we should have is between tooth numbers 22 and 11. All posterior teeth are completely discluded. Only then can we guarantee that there is cuspal guidance and posterior protection.